The goal of this video lecture is to discuss treatment options for obsessive-compulsive disorder, including both pharmacological treatment options and options for psychotherapy. So when it comes to pharmacotherapy for obsessive-compulsive disorder, you likely will not find it surprising that the same kinds of treatments that are efficacious for treating anxiety disorders are also used for the treatment of obsessive-compulsive disorder, given the similarities between the two different groups of disorders. Our primary pharmacotherapeutic treatment for obsessive-compulsive disorders is the antidepressant medications. So a range of antidepressant medications have been found to be effective for treating obsessive-compulsive disorder. This includes both tricyclic antidepressants. In particular, there is one tricyclic antidepressant called clomipramine. The brand name is anafranil, that has been observed in clinical practice to be particularly efficacious for treating symptoms of obsessions and compulsions. So there's not really strong research evidence to support the superiority of this one specific antidepressant medication over other antidepressant medications, but in clinical practice, many psychiatrists have reported that they see the best treatment response with clomipramine. So many clinicians will use clomipramine as their first-line treatment for obsessive-compulsive disorder. We also see efficacy when we use other antidepressants, for example, the SSRIs. One thing that is interesting about using antidepressants for obsessive-compulsive disorder in comparison to major depression or our other anxiety disorders is that we tend to see the need for higher doses than we need to treat mood disorders and some of the anxiety disorders. So our antidepressant medications tend to be effective for treating OCD, but we may need to treat the patient at a higher dose in order to see that efficacy. But when we have a patient on an effective dose of an antidepressant medication, we tend to see about a 50 to 80% response rate. So remember, responders are individuals whose symptoms are improving by at least 50%. So we're seeing a comparable response rate to the response that we saw using antidepressant medications for major depressive disorder. So here I'm showing you results of one of the earliest randomized controlled trials of antidepressant medication for treating obsessive-compulsive disorder. So this was a study looking at clomipramine. This is that tricyclic antidepressant that clinicians have reported is especially helpful for obsessive-compulsive disorder. And you can see that at pre-treatment, the symptoms of OCD in both groups were similar. There were no significant differences between the two groups. There was a slight decrease in symptoms of OCD in the placebo group, but a much greater reduction in symptoms in the group that received clomipramine. And at post-treatment, the group that received the antidepressant medication reported significantly lower symptoms of OCD than the group that received a placebo. So we see this across various antidepressants that at a sufficient dose, we see good response to these pharmacological treatments for obsessive-compulsive disorder. We also have a really effective psychological intervention for obsessive-compulsive disorder. And the specific psychotherapy that is used for OCD is a treatment called exposure and response prevention. So exposure and response prevention is primarily a behavioral intervention for obsessive-compulsive disorder. It shares a lot of features with our behavioral interventions for anxiety disorders, but it has some unique components that are designed specifically to treat obsessive-compulsive disorder. So the first component that's going to look really familiar is to expose the patient to the circumstances that provoke distress or lead them to engage in their compulsive behaviors. So just like in our anxiety disorders, it's important to expose the person to the situations that lead to their fear response. So whether it's their phobic stimulus, or whether it's social situations for someone with social anxiety disorder, or whether it's the symptoms of a panic attack for someone with panic disorder, it's really important for the individual to be exposed to the anxiety-provoking stimuli. So that also holds true in obsessive-compulsive disorder. But it is particularly important when treating obsessive-compulsive disorder that the patient also be prevented from engaging in their compulsive behaviors. So while the person is going through the exposure, it's very important that the patient and the clinician both agree and maintain that the patient cannot engage in their compulsive behaviors. So through this process, the individual is able to habituate to those anxiety-provoking stimuli in much the same way that we see in our exposure-based treatments for other disorders. But it's important to prevent the patient from engaging in their compulsions because of that potential negative reinforcement by reducing the anxiety. So it's really important over the course of exposure and response prevention that the patient not be allowed to engage in their compulsive behaviors. So here are some results from an early study looking at the efficacy of exposure and response prevention, and they actually compared this to antidepressant treatment with clomipramine, and they also compared it to a combined treatment where patients received both clomipramine and the exposure and response prevention. So you can see that we have the least improvement in symptoms in the placebo group, that's the blue line. We have a significant but smaller reduction in symptoms of OCD in the group that received antidepressant medication alone. And we see very dramatic reductions in symptoms in both groups that received exposure and response prevention. So whether they received that as a standalone treatment or whether they received it as a combined treatment and both engaged in the psychotherapy and received antidepressant medication, both of those groups showed a really dramatic reduction in their symptoms that was maintained over the 12 weeks of the intervention. So exposure and response prevention is a very effective treatment for obsessive compulsive disorder, and there's even some evidence that the psychological intervention for obsessive compulsive disorder could even be more effective than our pharmacological treatment options.